Hey, this is Dr. Anderson from Anderson Podiatry Center, and a real common complaint people have is sometimes they have great toe joint pain. I'm not talking about bunion, where you have a big bump on the side of your big toe, but this is another problem called Hallux Rigidus or Hallux Rigidus. It means the big toe doesn't want to move up very much. Normally the big toe should come up about 60 degrees off the ground, and for some people it might only come up 10 or 20 degrees or even 10. This is a young lady that's not even in her 30s and had quite a bit of big toe joint pain, some limitation of motion, but surprisingly a lot of pain for her young age. And sometimes when we do these surgeries, we get in here and we never know what to expect. And sometimes the cartilage is pretty good, sometimes there's lots of spurring or a little bit of spurring. But part of what we do with this procedure is we oftentimes will shave out any extra spurring, because there's spurring usually on the top of the joint. But the other thing we do is when we're in here, if we see cartilage that's damaged, we may need to repair it. And I'm going to show you what we do here. There's an area on her metatarsal head, we call it, and it's right here. You can see this is nice, healthy cartilage, and right here is where the cartilage is worn down to bone. There's nothing but bone there, and that's why she had such extreme pain for her age. So I'm going to show you what we do. I'm going to, if you can pan in here, I'm going to make a couple very small little drill holes here, like so, and I'm going to put another one over here. And while we're doing this, it's just to increase blood flow. The trauma that I just did to that area is going to promote bleeding in the joint, and then that blood that's carried to this area, you'll find there are cells that can help repair the cartilage. It works really good on big toe joints. It's called the microfracture technique. Maybe you've heard of it. It can be done on knees and hip joints, but it doesn't work as well because there's a lot of vertical load on those joints. It's very advantageous on big toes just because of the biomechanics. There's very little load on a big toe joint because the joint's sitting horizontal to the surface. So it's something to realize. If you have big toe joint pain, it might be good to get in, and it's like patching up a tire, I guess. It helps repair that cartilage. So, and it's a way that your body can do it on its own. So anyway, thank you for watching, and please subscribe to our YouTube channel.